I am Swati Prakash and I am working in BPT University as a senior assistant professor. Today's topic is the types of parental products. So the first one today I will discuss about the introduction, types, advantages, limitations and factors of parental products. So the first one is parental products. The term parental has been derived from the Greek word parenteron, which means outside the intestine. These are unique dosage forms as they are administered by injecting directly into the body tissues through skin and mucous membrane. According to BP, parenteral preparations are sterile preparation intended for administration by injection, infusion, or implantation into human or animal bodies. According to WHO, parenteral preparations are sterile, pyrogen-free liquids like solution, emulsions, or suspensions, or solid dosage form containing one or more active ingredients packed in either single dose or multi dose containers. They are intended for administration by injections, infusions, or implantation into the body. Next I discuss about the types of parenteral products. The parenteral products are divided into two types. It is based on volume, and the second one is based on the state of products. So first we discuss about based on volume, the parenteral products are divided into two parts. The first one is SVP. If we discuss about SVP, a large volume parenterals is a unit dose containers of SVP is a small volume parenteral, is a catch all for all non LVP parenteral products except biologicals. Or second one is LVP, a large volume parenteral is a unit dose containers of greater than 100 ml that is terminally sterilized by heat. The next one is the based on state of products, it is divided into the given parts like injection, infusions, powder for injection, concentrated solution for injections, implants, injectable emulsions, and oily emulsions. If we discuss about the parenteral routes, we have so many routes for parenteral products like intravenous. Intravenous is injected by vein, and intramuscular is given by muscle tissues. Intradermal is given as dermis of the skin, and subcutaneous is subcutaneous tissue of the skin. Intrathecal is subarachnoid space of the spinal cord. Epidural is space of the spinal cord, and intraarterial through artery. Intraarticular is injected through joint space, and intracardiac is injected through heart, and intraocular is injected in eyes, and intraperitoneal is injected site is peritoneal cavity. So the first part is the parenteral products is based on the volume. So we have two parts. First one is SVP. As I discussed, SVP is small volume parenterals, an injection that is packed in containers labeled as containing 100 ml or less. It is available in single or multiple use, and used for administration of drug, and preservatives are used. It is administered through various parenteral routes, like examples are insulin injection, procaine, penicillin, G injections. And the second one is a large volume parenteral. These are parenteral designed to provide fluid, calories, and electrolytes to the body, and the volume is more than 100 ml. It is used as single use, and it is used to provide calories, electrolytes, fluids, and preservatives are not used. It is administered through IV infusion techniques. Example: saline solution, mixture of dextrose, amino acids, lipids, and vitamins. Second, it is divided on the based on the state of products. The first one is injection. Injection contain sterile solutions and are prepared by dissolving the active ingredient and other substances in water for injection or other suitable non-aqueous base or a mixture of both. The solution to be injected may show sediments which can be dispersed easily by shaking the container. The suspension should remain stable in order to deliver a homogeneous dose whenever withdrawal is made from the container. Injections, they are prepared using an aqueous solution. It is divided into two dosage types, like single dose injections. They should not contain antimicrobial preservatives unless justified and authorized. Second one is multi dose preparations. They contain a suitable antimicrobial preservatives in appropriate concentrations, except in cases where the preparations themselves have adequate antimicrobial properties. Multi-dose preparation should normally not exceed 30 ml. The second one is the infusions. These parenteral preparations are composed of sterile aqueous solutions with water as its continuous phase. The preparations are free from bacterial endotoxins or pyrogens and are made isotonic with blood. They do not contain any antimicrobial preservatives. The second one is powder for injection. These are sterile solid compounds that are distributed in their final volume when the vial or container is shaken to form a clear particle free solutions. They are sterile, pyrogen free solid substances distributed in their final containers, and which, when the prescribed volume of the appropriate sterile liquid is added, rapidly form either clear and practically particle free solutions or uniform suspensions. Second one is concentrated solution for injections. They are sterile, pyrogen free solutions intended for injection or infusion after dilution. They are diluted to the prescribed volume with a prescribed liquid before administration. The concentrated solutions are diluted with water for injection before they are administered through injection or through intravenous infusion. Next one is implants. Implants are sterile solid preparation containing one or more active ingredients. They are of a size and shape suitable for parenteral implantations and provide release of the active ingredients over an extended period of time. They are presented in individual sterile containers. They are stored in sterile containers individually. Next one is injectable emulsions. These are liquid preparations in which the drug substance are dissolved or dispersed in a suitable emulsion medium. These products provide essential fatty acids and vitamins. And the next one is the oily injections. These are used to prepare parenteral controlled release dosage forms. There are some general requirements for a parenteral dosage form. The first one is sterility. All the parenteral products must be sterile. Preparation should be free from all the types of microorganisms, and aseptic conditions are required to maintain during the preparation of parenteral products and its administrations. Next requirement is stability. All the product must be stable. The physical as well as chemical stability of parenteral preparations must be maintained during storage. The third requirement is isotonicity. The parenteral preparation should be isotonic with blood plasma and body fluids. It is very important in order to avoid any complications on the administration of parenteral products. The fourth requirement is free from pyrogens. The parenteral preparation should be free from toxins and pyrogens. The parenteral product must pass the test for pyrogen because contaminated parenteral products cause rise in the body temperature after its administration. Next one is free from foreign particles. The parenteral product should be free from foreign particles such as dust and fibers. Specific gravity. The parenterals meant for intraspinal injection should have the same specific gravity as that of spinal fluid into which the same are to be injected. Chemical purity. The parenteral preparations should be free from chemical impurities or it should be within certain limit as specified in the monograph of that preparation in the pharmacopoeia. So the next is the advantages of parenteral products. Parenteral products can bypass pre-systemic or first pass metabolism and the onset of action is quick. The drug which cannot be administered orally can be administered by this route, and the patients who are vomiting or unconscious cannot take drug by oral route. In such cases, the drug can be administered by this route. The drug action can be prolonged by modifying the formulation. This route can deliver transfusion fluid containing nutritive like glucose and electrolytes such as sodium chloride. There are some limitations of parenteral products. The first one is pain on injection causes pain at the site of injection. The trained persons are required to administer the drug. The administration of drug through wrong route of injection may prove to be fatal. It is difficult to save a patient when overdose is given. There are chances of sensitivity reactions or allergic reactions of a drug by an individual. Side effects are quicker than that of the drug given by other route. It is essential to follow a strict aseptic technique in order to avoid possibility of infections. The last part is the factors affecting the factors affecting the parenteral products. The first one is melting point. It is the temperature at which the solid and liquid phases are in equilibrium. Its determination is a primary indication of purity. Solubility. This property is essential for developing solution to be injected either intravenously or intramuscularly. It is a function of chemical structure. Salts of bases and acids are the drug that can achieve the desired degree of water solubility. Molecular structure and weight. These are the basic characteristics of the drug from which the potential properties and reactivities of functional groups can be determined. Particle size and shape. The study of particle size give information about solubility, dissolution rate and absorption, etc. These characteristics are determined by scanning electron microscope or an optical microscope with polarizing attachments. Next one is the ionization constant. This property is used to determine the pH dependent solubility of the compound. Potentiometric pH titration or pH solubility analysis is used for determining the pK value. Ionization constant of a compound also help in determining the degree of ionization of an acid or base. Degree of ionization depends upon the pH. For acidic drug, pK ranges from 3 to 7.5 and for basic drug, pK ranges from 7 to 11. Partition coefficient, it is a ratio of equilibrium concentration of drug in aqueous and oily phase in contact with each other at a constant temperature. Partition coefficient can be expressed as P oil by concentration in oil phase or divided by the concentration in water. So it is a ratio of the drug concentration in oil phase and the concentration of drug in water phase. Next one is hygroscopicity, the tendency of a solid to take up water from atmosphere. As it's subjected to a controlled RH program under isothermal conditions. A high degree of hygroscopicity can adversely affect the physical and chemical properties of a drug substance. So this is all about the types of parental products. So have a nice day and thank you.